All right, everybody, we'll get started. I appreciate you all coming and joining us for this conversation. This is basically, to some extent, a part two to an earlier conversation that we had. I don't remember how long ago that was, about a month ago or so?
It was actually in June.
Is
I
it
was
really?
just I,
Wow.
I was just looking. Yeah.
This year, under all circumstances, this year continues to just fly by. Anyway, um, so what we'll do, we opened it up to questions and people submitted some questions, which we're definitely going to cover. And by reading those questions, it made me start thinking about, kind of where everybody might be in their process of thinking through, either their health challenges or the health challenges of their family, whoever, you guys might be caring for. And I want to paint a picture because to me, this is the philosophy by which, we function in our office. And I think it might help maybe to just kind of zoom out on the health issues and situations that we all face and just think about it maybe a little bit differently. And then I think the rest of the conversation will make more sense, once we have a chance to go through all that. So this is an idea. This is something, I mean, I don't know, for those maybe that have seen the book that we finished writing, beginning of 2020, this is in there too. So if you've read that book, this is kind of familiar to you. If you haven't, I think it's an important thought. So we use an analogy, we call it the plant analogy. And the plant analogy, I think, just helps, like I said, form an understanding about physiology, like how things go wrong, and maybe a way to approach how to improve things if we need to. And so the idea is this: if you had a plant and that plant was obviously not doing well, showing some signs of dysfunction or disease, we wouldn't just throw that plant away. And we also wouldn't just, if the leaves were turning brown, we wouldn't just paint them green. Or if the plant was wilting, we wouldn't just tie strings to the plant and try to hold that plant up. We generally have an understanding about what makes plants healthy and what makes plants ill. And so for the most part, without asking the audience the ideas, we all have an idea in our head with what we might do. So somebody might say, well, I would water that plant, or I would give that plant some sunlight, or add some nutrients to that plant, all of which are good answers and the right answers. But the thing is this: when we think about the plant, we immediately assume that either it's not getting enough of something that it needs, or it's getting too much of something that's hurting it. Yet when we have problems, we don't automatically have that same thought necessarily. And I think that we should. And I think that if we look at ourselves similarly to that plant, it helps broaden our understanding of how we can improve our health, or what pieces of the puzzle we might use to improve our health. And so if we did a study with that plant that wasn't doing well, and we said, listen, I want to isolate all of the variables and make sure that we're only doing, one treatment at a time to see what we could do to improve the health of that plant, we would conduct a study. We would put plants in different groups, and we would say, okay, this wilting, dried up, unhealthy plant, but we're only going to give it sunlight for 3 weeks, nothing else. We're not going to give it any water. We're not going to give it any nutrients. We're not going to make sure the soil is clean of any, toxicity. We're just going to give it water and see what happens. After a few weeks, I think you could imagine that that plant is not going to look any better necessarily. So the result of that study might be, okay, well, we gave this plant water for 2 weeks. Water did not improve the health of this plant. Therefore, water is not necessary for this plant to be healthy. Let's try sunlight. So now we take a dried out plant and we stick it in the sunlight for 3 weeks, but we don't give it water, we don't give it food, and we don't clean the soil. After a few weeks of sunlight, how is that plant going to look? It's going to look probably even worse. And so the end of that result will be, okay, we gave a plant sunlight for 3 weeks, it dried out further, it wilted even further, therefore sunlight is not necessary for plants to be healthy. And we can keep going on and on, but the point is, we know that water is necessary, and we know that sunlight's necessary. But the issue here is that we can't isolate those variables. because if we isolate the variables, we'll never get that plant healthy. One second, I just have to bring a couple more people into the room. So if we never get that plant healthy, and then we're starting to draw inaccurate conclusions about the steps we took to improve the health of that plant. So the point is this: we know that that plant needs water. We know that the plant needs sunlight. We know that the plant needs nourishment in the soil. And if there was any toxicity in the soil, we know that we need to remove that. And unless we do all four of those things and do it for a period of time, we'll never see that plant get healthy. And if we do all four of those and give it time, we also know that generally speaking, that plant's health will improve. And so I bring this up just to say that there are so many people who come to us for such a variety of different conditions. And they've already been down a certain road, they've already tried certain things. And so often somebody might come in and say, well, I tried this diet, it didn't work, so we stopped doing that. And then it was recommended that I do this therapy. It helped a little bit, but not as much as we were hoping, so we stopped. And then I was on Google, and Google said, try this vitamin. So we did that. We saw improvement in this area, but not so much in that area, so we stopped that. And then we tried, this other thing. And many of us are on that journey, and it's nobody's fault other than, we need help, and we need a guide, and we need people that we can trust, and we need people who understand the bigger picture when it comes to health, so that somebody can help formulate for you or for your son or daughter or, mother, father, or husband, wife, whoever it is that, whose health is being challenged. We need to understand your version of the story of that plant so that we can understand, are you getting too much of something that's hurting you? Are you not getting enough of something that you need so that your body can repair? And if we can just put those pieces back together, most of the time we see improvements, and we see the types of improvements that we want. But we need to do that, and we need to give it time. And we can't necessarily abandon some of those things too prematurely, or we'll never see the result that we're looking for. So I wanted to start with that just to kind of give everybody, a broad idea of, what we think about and how we approach things, because I think hopefully that might help you in your journey as you go along. Now, we do offer a lot of different services in our office. We don't offer everything by any stretch, and there are plenty of things that I wish that we had that we don't. And so part of what we do is try to incorporate as much as we can within the four walls of our clinic. And then wherever we fall short, we try to make relationships with people who are doing some of these other therapies that we know are synergistic and helpful, so that we're able to refer back and forth and make sure that, the patient ultimately, the only thing that matters is that the patient gets what they need. And so we spend a lot of time trying to figure out where a lot of these pieces fit. We incorporate where we can. And then, like I said, we find other people who are doing the pieces that we can't. Because as long as we can put together enough of those pieces and get the patient as many of them as we can get, we will see the results that everybody's ultimately looking for. So I do want to talk about some of the things we do offer. I'm happy to also talk about plenty of things that we don't. This isn't about us or our office. This is about you and understanding therapies that, hopefully might help you or whoever you are caring for. So the main idea was, initially we were talking about hyperbaric. That was the initial conversation that came up and where that fit. Christy, did we record that?
We did, and there is a...
Yeah, somebody asked that in the chat. Is that available somewhere?
Yeah, there's a link actually on the HBOT USA YouTube channel, and then there's a link in my group, Hope for Denise, and then we could post it here as well.
Okay, great. Yeah, those are things I should probably know, but I do this part. I don't do that part. So that's great. So somebody asked that question. Yes, we do have that, so you can grab that. So I don't want to go too much into the oxygen piece because I think we did a good job that day. And if you're interested in that, you can go ahead and take a look at that link. But the idea there is, my understanding of physiology is that the health of each individual cell inside of our body dictates ultimately the health of every organ, and the health of every organ dictates the health of every system. And then when you put all those systems together, that's what dictates the health of the organism or the person, whoever it is that we're talking about. And so what we're looking to do is we're looking to improve the health of cells. That's how I think about it. And if you think about it that way, you have to understand that every cell requires virtually the exact same ingredients, or every cell is poisoned by the exact same ingredients. And so when we understand that, and we could look very specifically at each person, we start to understand where those challenges actually lie within the cell. And then from there, we can formulate the plan of how to make that cell healthy. And when we make that cell healthy, every other cell is going to follow suit. And so, you know, oxygen is a big piece of that. We know that virtually every cell in our body requires oxygen. We also know that most of us, for various reasons, are getting almost as much oxygen as we possibly can at any moment. And if it were possible to increase the amount of oxygen we were getting, we'd be able to feed or fuel our system better. And to date, the only tool we have that increases oxygen at a level that is meaningful for these types of conversations is hyperbaric oxygen. And so that's why that's our main piece when it comes to oxygenation of a system, when we're trying to fuel a person who has oxygenation issues. And the list of those folks is pretty long, and we might catch on some of that with the questions that people ask. You know, next we'll go into some of these other categories of therapy. So when we're talking about oxygen, it's not just the cell, and I don't want to bore people too much with physiology, but this is important. There's one little part of every cell that makes energy for the cell. And it's called a mitochondria. You can look it up. It's super interesting. I love this stuff. But the mitochondria makes energy for our cells. And if we're able to make the energy that our cells need to make, our cells could actually perform their jobs. And if we cannot, then our cells cannot make the energy that they need to make to do their job. The majority of chronic illnesses, and I'll just name a few, but autism, almost every autoimmune disease you can think of, Crohn's, colitis, Hashimoto's, MS, ALS, I mean, autoimmunity as a whole, a certain amount of cardiovascular disease, cancer for sure, neurologic degenerative diseases, all of these conditions, one of the main themes that they all share in common is mitochondrial dysfunction. Chronic illness is completely wrapped around mitochondrial dysfunction, and helping the mitochondrial function properly and improving its health is ultimately one of the most important factors to creating health of that cell. So I bring that up because most of the other things I'm going to recommend are directly related to improving mitochondrial function. So oxygen is one, because that's one of the most important pieces. And if you look at a mitochondria, think of it as a factory, and that factory is taking all the stuff that we're eating and basically making energy from that. Okay, so the raw material is food, and then the widget, the end result that the factory is making is a thing called energy. So every step of the way, from exactly what raw materials we're putting in, through how all of the systems that have to, process those raw materials, all the way up until making energy, those are places that we can intervene. So let's start at the beginning. Food. Mitochondria, especially dysfunctional mitochondria, tend to burn glucose, sugar, really, really well, and burn fat terribly. And that's not ideal. When our body can burn fat efficiently, our body could make tons more energy than when it burns sugar. And so one of the things that we do for so many chronic illnesses is help shift people away from high carb and high sugar diets toward high fat, lower carbohydrate diets, because if we can improve fat metabolism, then we can improve mitochondrial energy production. And that to me is a critical piece of this whole puzzle. So there are lots of steps to that, way too many to go into here, but something to think about would be, if you wanted to improve how well your body makes that energy, shifting your diet in that direction would be very, very helpful. Next, there's certain steps to finishing making that energy. So one of them is you have to move material from over the left side to the right side. And a nutrient that does that is CoQ10. So CoQ10, specifically a thing called ubiquinol, a type of CoQ10, is a nutrient that we could find in our diet, but most people with mitochondrial issues should consider supplementing with it. By increasing your CoQ10, you're increasing how quickly you could move the product from the left to the right. And when you have more, so if you're putting the right fuel in and you start moving it down the assembly line, you're going to start making more energy, period. And so CoQ10 is a nutrient that we use often for this purpose. The next spot in the assembly line that we have to move the product from one end to the next is very sensitive to light. And so you've probably heard of red light therapies, or infrared saunas, or infrared beds, or red light beds, or red light nasal tools. Red light is something that's come up, I think, probably quite a bit in many of your searches on different modalities you might use. And this is one of those places. It fits in a couple places, but this is one of the most important places it fits. Red light in the mitochondria will stimulate the movement of those same products down the assembly line. So ultimately, we're starting with food and we're actually ending with oxygen. And so when we put the right food in and we add CoQ10 and then we add red light and then we add oxygen, you've now created a recipe for all the places that you could manipulate mitochondrial function. You've just done that virtually by doing those four things. So when you're dealing with chronic illness and you have a chance to manipulate those four variables, just like I was talking with the plant, there's usually 4 or 5 variables that are very meaningful. Those 4 for mitochondrial function are critical. You could add a few more to that. NAD, you may find out there as you look around, specifically NAD+, which is a specific type of vitamin B3. So B3 is niacin, and niacin has many different forms. And when it comes in this form, NAD+, and there's a variety of ways to administer that, NAD+ plays a huge role also stimulating this cycle. And there was one more in my head that I wanted to talk about. I'll come back to it. But those pieces, that would be a very meaningful approach to addressing, a lot of chronic illness. Now, how does that show up in people's lives? If you can't make enough energy in your liver, then you can't detoxify properly, or you can't clear or produce hormones properly. Your liver's in charge of a lot of things, but let's just summarize and say detoxification and hormone recycling. So if you don't make enough energy, you can't do that in your liver. If your brain's not getting enough energy, you would see brain fog, you would see memory loss, you would see, signaling issues like motor control, or neuropathy like sensory issues or strength issues. If your intestines didn't have enough energy, you could have malabsorption or digestive issues or GERD or, so many different digestive issues. If your muscles didn't get enough energy, you could have fatigue. That could show up as generalized fatigue. That could show up as chronic fatigue. That could show up as just in your life, not being able to, walk far enough without just feeling like that heaviness in your legs or your arms. If it was in your spleen or your bone marrow, it might affect your immune system. So again, mitochondrial dysfunction plays this huge role in energy production, and then ultimately in all of these organs and all of these tissues working properly. So getting the mitochondria fixed up and working better is always a piece of that puzzle. The other thing that oxygen does in relationship to this is that oxygen will also increase the number of mitochondria that you have. So whereas all these other things I'm talking about will make a mitochondria work better, each one will work a little bit more efficiently. Oxygen is part of that. If you had, I'm just making up numbers because these are not real, but if you had 50 mitochondria in your body and they were working at 50%, and you added these therapies that I'm talking about, and now all of a sudden, instead of 50% energy production, you can get 75% energy production, that would be an amazing improvement. And you would feel that and you would see that. If you then also, instead of having 50 mitochondria working at 75%, you had 100 mitochondria working at 75%, you just doubled your output. And so one of the things that hyperbaric does that these other therapies don't, but it is synergistic with them, is the ability to increase the number of mitochondria we have in our body so that as we're making them work better, we also have more of them. And so that's kind of I'd say the big picture, around a lot of those. Some of the other things besides, let's say, diet, red light, CoQ10, nutrition and oxygen, a lot of people come across detoxification, which there were a couple questions of, and I'll just kind of cover briefly. But in order to detoxify properly, there's a million, not a million maybe, or there might be, but there are so many cleanses and, detox programs and detox supplements and foods that help you detox and shakes that help you detox. And a lot of them are great and some of them aren't, but they all also do different things. And we need to understand them a little bit better before you choose when to put them in and where. Because here's the thing. There's only so many ways to get something out of your body, okay? You could basically, I have little kids, so you can pee, you can poop, you can exhale. So when we breathe, we actually remove certain toxins. So you could pee, you could poop, you could breathe, okay? And you can sweat. So it comes out of our skin as well. Our skin is actually probably it's our biggest detoxification organ that we have. Now, here's the thing. Again, if your detox pathways don't have the right energy, they're not going to work well. And if even if they have the right amount of energy, if those pathways aren't wide open, you can come across problems. In other words, imagine you had mercury, okay, stuck somewhere in your body and you're going to detox that, but you're also constipated and you don't have sweat, your sweat glands aren't working properly. All of a sudden, you're pulling mercury, which is probably one of the most toxic metals that we could possibly be working with. We're going to pull it out of storage, and now it's supposed to go out, through your stool, but you're constipated and there's no way out. So all we did was we took it out of storage, out of the bucket that it was in, and it might not have even been hurting you as badly. It might have been kind of quiet and stuck in storage. We brought it up to the surface and then we couldn't get rid of it, which means now we're going to store it somewhere else. The body's going to take it. It can't stay in the bloodstream. So the body's going to take it and it's going to try to store it somewhere else. Very risky and, often ends poorly for people. So when it comes to these programs, we can't just assume that everything's working well. In most cases, we can almost assume that it's not. And so in most detox pathways, what you want to do is you want to spend time before you even reach in to grab toxins to pull them out. You got to spend time making sure kidneys are working well, that your intestines are working well, that you're not constipated, that your skin is healthy. All the detox pathways and all of the elimination pathways need to be working well before we go in and reach into storage and start grabbing stuff to pull out. In many cases, if you do it this way, by beginning that process, just by opening the doorways, especially if they've been stuck for some period of time, and often they have been, just opening the doors helps. Because most of us have some amount of free floating toxicity. And if our elimination pathways are subpar, just opening the doors and letting that out will almost immediately improve our symptoms, because we're starting to detoxify just by doing that. Once we know that those systems are working well, then it's appropriate to start, talking about or introducing some other type of detox program where now we're reaching into, into the body, into the tissues, pulling toxicity out and removing it, successfully. So, I think it's worth, in many cases, you do a little bit of homework to find out what is the toxicity we're dealing with. Is it pesticides? Is it heavy metals? Is it, other petroleum chemicals? Is it food? In so many cases, we have food intolerances that we don't really know of. So, again, it's finding that person that you can trust, that you could work with, that understands all these concepts. And you say, okay, listen, you may or may not need to detox. So first, we're going to run a battery of tests to understand if toxicity is even part of your story. Once we know if it is, we'll know what it is. Then we can spend some time making sure all your elimination pathways and detoxification pathways are working properly. And then we can actually detoxify you with whatever the chemical toxin happens to be. And depending on the toxin would determine what ingredients might be used to help that process happen. So I hope that helps kind of think through some things. I have patients all the time, either email me or coming into the office that, I bring up detox. They're, oh no, I tried that and that was a nightmare. That completely set me off, or my child, or whatever the case was. It was the worst thing we ever did. And I don't doubt that that's true, that experience is accurate in terms of what happened. But my concern is always, well, did we do all those steps? Did we make sure that that person was ready for that program? Or did we institute a program that was too aggressive and that body wasn't ready? And as a result, we set off, a cascade of events. With all the therapies that we could do, if they do something good, they could do something bad. I mean, that's just a reality of therapies across the board. And knowing which ones to do, when, how often, at what frequency, for how long, that's the art form of practice. And to be very clear with all of you, we've been in practice for 16 years. I don't know all the answers. I'm in practice. That literally means I'm practicing, and over time, and I'm dedicated to learning as much as I can. So over time and continuing to learn and having experiences, we have formulated, processes and plans that have allowed us, to really improve our programming and the odds of people getting better. But, there are often times where we're putting it together, the best we can for a patient. And so, I just want to say that out loud. Anyway, molecular hydrogen. That was another sort of, I don't know if highlight is the right word, but people were asking questions about that last time. And so I just want to fill in the gaps. And now that I'm saying that out loud, that was the other thing I was going to say when I was talking about mitochondria. So it came back. So molecular hydrogen, if you looked at our chemistry, not that most of us care enough to do this, but we are literally carbon, oxygen, and hydrogen. That's what we're made out of. And as complex as we are, and all the different body parts that we have, and all the different chemistry and chemical reactions that occur, and all the different tissues that we have, at the end of the day, we're basically carbon, hydrogen, and oxygen. And so hyperbaric works in many ways because oxygen is this chemical component that makes up so much of what we're made out of and contributes such a big part of, like I was saying, energy production. Well, hydrogen is similar that way. Now, the difference is most of you have probably heard of a thing called antioxidants, okay? And antioxidants are things that try to protect us from, so antioxidants are good guys, let's just say, and oxidants, other words for that are free radicals or reactive oxygen species. You know, these are bad guys theoretically that can hurt us or do damage to our tissue. And so antioxidants are constantly trying to protect us. Some antioxidants are like vitamin C, superoxide dismutase, you know, different things like this. So vitamin E could act like an antioxidant. So I'm bringing this up because the balance in our body, there's a very, very delicate balance between some amount of oxidation, which too much will hurt us, but we do need some, and reduction, which is the opposite of oxidation, okay? Reduction is what antioxidants are able to do for us. So if we have too much oxidation, our cells will get damaged and eventually die. A lot of, if you think of like the radiation from the sun and the damage that sun might do to our body to some degree, although some sun is very healthy, too much sun can damage our cells. That's oxidation. If you think of rust on metal that sits outside, that's oxidation of the metal. And imagine you could, you know, sand that rust off and then paint it so to protect it. That's what antioxidants do. And so we have this very delicate balance between oxidation and reduction. And I bring this all up strictly to tell you that molecular hydrogen plays a huge role in the reduction pathway. So if we have health challenges, if we have too much inflammation, if we have too much stress, if we have chronic illness, we probably have an outweighing of oxidation reduction. And if there was a way to improve our reduction or improve our antioxidants, if you will, that would help rebalance the oxidation and reduction pathways. Obviously, I'm simplifying this a great deal, but I hope you understand it. Molecular hydrogen is an amazing tool for improving that balance and improving the reduction pathways in our body. There are many different ways to administer molecular hydrogen. You could imagine, like oxygen, hydrogen is a gas. So you could get, just like you can get oxygen as a gas and you can breathe, you can get hydrogen as a gas and you can breathe it. So they make hydrogen generators, you know, and they come with like a cannula or a mask, and you could breathe molecular hydrogen. You could take molecular hydrogen gas and you could stick that hose, instead of on a mask and you could breathe it, you could actually stick it in water and you could bubble hydrogen into the water and then just drink the water and get the gas that way. Or you can get molecular hydrogen tablets. And that's typically what we do and recommend because it's the easiest and least expensive. Christy, if you remind me, we can put a link to the one we recommend and use, if that's helpful to the group.
It would.
So,
I actually tried that one and I saw huge results for me and my daughter, especially with energy and alert. It was huge.
You used the one that we used?
Yep. I used some on myself and then I used it on my daughter while we were diving, and her energy probably goes up about 60% just from it within a couple of hours.
Yeah. So what you do, these tablets, for lack of a better way, they're like effervescent. They're it's like Alka-Seltzer, if you will. You put it in and it bubbles. And so it's actually a magnesium supplement. But when this type of magnesium reacts with water, it releases hydrogen gas, and the bubbles that you see forming in the water are hydrogen. And so you let it bubble out until it's basically dissolved, and then you can drink that water, which is now full of hydrogen. And that's a great and easy way to absorb it. And like Christy said, there are certain things that work really well together. Hydrogen and oxygen are amazing. And so often we'll do molecular hydrogen roughly 30 minutes before hyperbaric. And it's it's pretty remarkable what we see as a result. So I wanted to make sure I touch base on that. From there, Christy, I think I'm going to start hitting up some of these questions.
That'd be great.
Okay. So this is not necessarily in any particular order, and I'll probably, I downloaded all these emails that we got, and I'll just kind of summarize them and hopefully hit the high points. But you mentioned in your book, there's a synergistic effect between hyperbaric and red light. How do you maximize using them together? One versus, which one first or second, or how long? Give an idea of which supplements could be used close to a dive. And could ozone insufflation in that time frame also help? So there are a lot of different ways to deliver oxygen. Hyperbaric is one, ozone is another. I love ozone. There are certain similarities, like they're oxygen and you're delivering oxygen, and there's certain differences, like one does certain things better or worse than the other a little bit. So to know that if you're really looking to improve, let's say, mitochondrial function and all these things that we're talking about, mitochondrial biogenesis, which means making more mitochondria, or ATP production, the energy production, the things that we're talking about, hyperbaric works definitely better than ozone. But if you're looking at like microbial balance in terms of like good bacteria and bad bacteria, and trying to keep the balance of bacteria in your body very healthy, or there's an infection and you're trying to kill the infection, also both will work, but I think ozone is stronger for those purposes. Are they synergistic? Yes. Again, you're just delivering oxygen in different ways. Ozone has a much higher oxidation rate. So remember, we're talking about oxidation and reduction. Hyperbaric does create some oxidation. We need to know that, but it's typically very low and safe amounts, not that it would hurt us. Ozone does offer more oxidation than hyperbaric. So knowing that, if you were using hyperbaric, I would use hydrogen. If you're using ozone, I would definitely recommend using hydrogen, because again, you're just trying to keep those they're called redox reactions, those reduction in oxidation reactions in relative balance, and that'll help that. So the answer to the supplements, just for a couple quick ones, the NAD, the CoQ10 and the molecular hydrogen, I think are great together. And then red light, besides moving things down the assembly line the way I was describing earlier, red light also increases the diameter of blood vessels. It's called vasodilation. So red light increases vasodilation and releases some other chemicals like nitric oxide. Yeah, that's a great, yeah. That's, is that the nostril? Yeah, that's a great product. So if you're using red light and looking to vasodilate, I love to use red light before hyperbaric. At the end of the day, if you're doing all these therapies at some interval, they're going to overlap, and you're going to get synergy from that. But listen, hydrogen sets the stage a certain way, red light sets the stage a certain way, and then oxygen really shifts the chemistry of our cells. And so, I mean, what an amazing thing to do, drink a glass of hydrogen and go into your red light for 15, 20 minutes, and then go right into your hyperbaric. I mean, the synergy there, as simple as that is, the synergy and in that order, I think that that's a remarkable way to really shift things, from the standpoints that we're talking about today. So I hope that answers. Next question. Could there be negative side effects or reactions to mild hyperbaric done too frequently or too long without a break? If so, what are those side effects? What should we be looking for? So like I said earlier, anything that's good for us has the potential to also be harmful to some degree. Mild hyperbaric is very safe. Somewhere between 2 hours and 3 hours in most cases, you're going to reach a level of saturation where your body can't absorb any more oxygen anyway. If you were in there longer, would you get hurt? No, there's no proof that that would ever really happen. There's no mechanism that I can think of that would ever really cause damage that way. But you're also at some point wasting time. If you're not saturating any further, you're not getting benefit any further. So most protocols start around an hour. They're usually an hour to 90 minutes, and on occasion we might recommend 2 hours. If you have your own research, especially current research, like in the last year to 2 years, frequency of use trumps duration of use. So 1 hour twice a day is going to be ultimately more beneficial than 2 hours once a day, if you could follow that. So the more often you do it appears to be a much more beneficial than, you know, if you did 20 hours, you know, and one went in every hour for 20 hours, the other one did 2 or 3 hours at a time and only went in 10 or 15, you know, 8 times or something like that, you're going to get much more benefit from the frequency of going in and out. So, and then, you know, we've basically done this question, you know, 240 plus dives. Should you take a break? I think you should take a break. There's a lot of benefit to being in the chamber, and there's a lot of benefit coming out of the chamber. And to some degree, and I think this is going to be true soon, we're going to have the evidence to support that going in the chamber is what sets the stage for a lot of these changes, but getting out of the chamber is actually what really solidifies the changes. And so I think it's important to use it often, and the frequency, because going in and out, I think, is what stimulates a lot of these therapies, but then taking a break also is going to stimulate certain changes. So yes, I love having one, the idea of having one and using it often, and there should be periodic breaks for somewhere, you know, the old protocol was always like a 3-week break. It could be a little longer than that. It could be a little shorter than that, but certainly a 1.5 to 2 week break every 50 or 60 hours or so would be relatively appropriate for most people. Quick disclaimer, this is not specific medical advice for any one person here. This is general guidelines and protocols for everyone to understand the process a little bit better. Same question about supplements and things like that, so we're not going to go there. So my son is a little older than most kids starting. He's 13. How can we tell if he's improving? Anything? So should we be doing the dives right after each other? We're doing 3 times a week at the doctor's office. We plan to do 40, but we may only go part way. We really want to see signs of improvement in speech specifically and or, you know, reading. Is there a certain amount of dives to do this? It varies dramatically. You know, every case is different. I would say that language, socialization, depending on the case, but socialization and languaging are 2 of the things that I think we see the fastest and the most with a lot of these kids. You know, 10, 15 dives, sometimes you see a lot and sometimes you really don't. 40, honestly, in many cases is just getting started. It's really, you know, 40 is like the protocol in the research process, but if you get to 40 and you're seeing changes and you're happy with the changes that you're seeing, the likelihood that there will be more changes is very high. I wouldn't stop at that point. If you got to 20 or 30 and you've seen nothing, I still wouldn't say that it's not helping. It probably is. But I would also say we're missing something. Maybe it's a diet thing. Maybe it's a toxicity thing. You know, there's so many pieces of that puzzle. Remember what I said when we started this conversation was we have to figure out multiple pieces, where the synergy is. And oftentimes single therapy modalities only are limited. And we won't see ultimately what we're trying to see. And when we start combining things the right way, if we've done our homework and we understand, let's say in your case, your son's challenges and where they are, and we put together a plan that has some synergy behind it, we'll see more changes faster than if that's, you know, if we're just doing that alone. So I hope that helps. But those are things, the things you're looking for are very common things to see improvements in. But to plan on doing that 40 before you call it, I think would be beneficial. So you at least have a better idea of what to expect. Or if you, like I said, if you get to like 20 and 30 and you're not seeing anything, I would pull back. I mean, if you were in my office, I would stop the therapy anyway and just tell you that we're missing something and want to look further to figure out what that is. So my little guy's he's 19 months. He's got a VP shunt, left side of the brain, hydrocephalus. My understanding is that hyperbaric is not good for hydrocephalus. Is there anything else you could recommend to help heal his brain? We are doing OT, PT. Speech is still developmentally delayed. What could we do? So I'm not sure what you may have either seen, read, or heard. I think that hyperbaric is perfectly fine and appropriate for hydrocephalus. It's not a cure by any stretch, like it isn't for many things. However, if there's swelling and or pressure and or those things are helping to cause a lack of blood supply, or there's nerve tissue and brain tissue that isn't developing properly, improving oxygen to that tissue will improve function. And it is safe. There's no reason typically that you shouldn't be able to do that, unless maybe there are other health issues that I don't know of. Again, this isn't medical advice. This is just general answering of questions. But I think that that's something you should consider and or look further into to see if it is appropriate, because I think it should and would help in theory. And what else can you do? I would work on the food front. Again, brain especially. So people used to think, and not that long ago, like 5 or 10 years ago, that the brain could only run on glucose and that there was no way to feed the brain anything other than glucose, because brain can't run on fat directly. However, our brains can run on ketones. And if we change our fuel source and we shift our fuel source from sugar, basically, to a ketosis type or ketogenic diet, we can massively shift what the brain is using for fuel. And there is a tremendous amount of research to support how neurotransmitters change when we're burning ketones in our brain, inflammation changes when we're burning ketones in our brain, signaling changes when we're burning ketones in our brain. So in order to shift that fuel source and shift some oxygen, molecular hydrogen wouldn't hurt. Those could be very meaningful for your 19-month-old, and could really start to set a stage to improve brain function and help them, start catching up a little bit. So I hope that helps you. I recently started mild hyperbaric. I have chronic fatigue syndrome, a history of sinus and ear infections. After about 25 sessions, my eustachian tubes became infected, acute, and painful. This is not uncommon. I'll cover this in a moment. So I took a break. I took some antibiotics. Still having trouble with draining and sinus infections. So there's especially also, again, in the last probably 3 years, there's been a very high amount of research coming out specifically on hyperbaric and chronic fatigue, as well as fibromyalgia. So, and it looks to help a ton. Specifically, we talked about how oxygen plays a role in energy production. And so chronic fatigue, for various reasons, creates this neurologic loss of energy production and this grossly acute hypersensitive nervous system that increases pain and other things like this. Improving oxygenation to that tissue is going to improve that tissue's performance basically every time. Now, there's really very few things that you cannot go into the chamber with. Pneumothorax is really one of the most important, which is literally like a popped lung, and most people would know if they had that. But if you can't equalize the pressure, you can't go in. And what I mean by that is, just like on an airplane, if you're not familiar, you have to clear your ears. As the cabin pressure changes, you feel that in your ears, and we need to try to equalize that, either like yawn, or some people chew gum or swallow. You could pinch your nose and blow it. You have to equalize the pressure in your ears, or it will be very painful, potentially uncomfortable. It's not going to, especially mild, it's not going to necessarily damage anything, but it could be very uncomfortable. And if you can't equalize, you just can't go in. And so people use different strategies. Earplanes, like the earplugs for airplanes, that seems to help a lot. You could use certain medications potentially. Some people use Afrin and some people use decongestants, things that just clear up the mucus so that the airways are open. And as long as the airways are open and you can equalize, you'll be okay. And if you can't, it's going to cause you more grief than it's worth. So for you specifically, I would spend the time working on that. We use apple cider vinegar on some regular basis as a way to also help clear out some mucus. That seems to help a lot. Neti pot, if you don't already, that's an amazing tool for also helping to clear out mucus and keeping the airways open. Certain practitioners, particularly chiropractors, do a thing called the eustachian sweep, which could help kind of open a clogged eustachian tube. So, you know, there are definitely strategies out there to help get you over that hump so that you could actually use this equipment more effectively. So, you know, think about that. And I guess in addition to that question, you know, I heard that you can't use lower pressure. You really need high pressure to do this therapy to make it work. You know, this is like, I don't know why, but this is like one of the most common misconceptions on so many ways. The way that we get oxygen when we breathe is because right now, even though you don't feel it, there's an atmosphere and there's pressure in the atmosphere. And when you breathe in, the oxygen that you're breathing in is a higher pressure than the oxygen in your bloodstream. And because of that pressure difference, oxygen just travels from your lungs into your, through your capillaries into the blood supply. As you increase the pressure, you increase the amount of oxygen that's able to drive. That's literally all you're doing. So if you increase the pressure and you increase the percentage of the oxygen you're breathing, if the air you're breathing has higher pressure in your lungs than in your bloodstream, oxygen is going to move from lungs to blood. Certain things like gangrene and osteomyelitis and osteonecrosis, like really bad diseases, they're bad diseases. You probably need higher pressure and higher oxygen. Most chronic illnesses are that. They're chronic. They're not acutely severe or necessarily life-threatening in this moment. And it's a question of healing over time. And so because of that, you could use lower pressure and potentially lower oxygen levels over longer periods of time in order to get a similar result. And so, you know, for most of these cases, sometimes more is better. That is sometimes true. Often it's not necessarily true. And where we lack sometimes in pressure and oxygen, we can make up for with frequency and duration, especially if you have the equipment at home. And, you know, therefore you could do so many more hours over such a longer period of time that I think the value would be there for you for that way. So I hope that answers that question. Next is, what detox methods do we use? How do we use them? Basically, you know, this person is talking about, you know, she has Lyme, which is definitely a pretty unfortunately common thing. And she uses a lot of different therapies to try to detoxify. You know, I can't go into detail necessarily on like specific products or programs necessarily, because there's so many, and different programs for different people at different times with different issues and in conjunction with what other pieces are we trying to put together. I wouldn't be doing it justice to really answer that as directly as I think you'd like me to, mostly because I don't know as much about your story, but I could answer it better if I knew more, and if you wanted to share that, we could do that at some point. But what I would say is this. So many people, I mean, if you just Google detox, like some lemon water or some cilantro or maybe some sun chlorella, or you know, you might even go a little further and find bentonite clay, or, you know, here's a shake that I could take that's a cleanse. Every therapy that you could do that's good for you could also harm you. And this is one of those cases that's very true. And you kind of just need to know more about where you stand before you introduce something that's going to shift your chemistry dramatically. what are we detoxing? Are your detox pathways open? Have we done the homework to really understand your version of that story? And then we can prioritize it and say, here's your issues. This is the order we're going in. And there's a rationale behind it. And we could use these other modalities synergistically to improve that process. I saw a question that came up in the chat. I think it said something like, does hyperbaric improve detox or detoxification? I mean, so directly, no, but indirectly, yes, in so many ways, primarily because if you improve intestinal function, if you improve kidney function, if you improve liver function, if you improve skin function, by default, you're going to improve detox pathways. And as a result, yes, oxygen can be used synergistically as part of a detox program because it's going to help the body get rid of those toxins or process them in a way. And then if it aggravates anything in the process, it's also going to help that tissue heal faster so that the symptoms as a result of the therapy are short-lived and you recover in a much faster way. I think this might be, maybe one or two more. What benefits does hyperbaric do in conjunction with high intensity weight training or blood flow restrictive training? Another word for that is KATSU training. And is HBOT possibly more beneficial before or after training? Is there an optimal time frame? So this is more of, I'm not using this therapy necessarily because I have a condition. I'm interested in the performance and recovery aspect of hyperbaric, which it actually, absolutely has a great place for this. Blood flow restrictive training, for if you're not familiar, is literally blood flow restrictive training. So you use devices that cut off your circulation temporarily so that you reduce the amount of blood flow going to the tissue. Normally, as you exercise, the body automatically increases blood flow to the tissue to fuel it. And what you're doing is you're cutting off that blood supply to some degree, or at least reducing it dramatically, so that even though your body's asking for it, you're not delivering it. Sounds counterintuitive probably to most of the people on the call, but there are massive benefits to this process, including certain hormone releases, certain vascular releases, certain growth and repair factors. So for people interested in this training and performance, KATSU is great. I use it myself. Hyperbaric to some degree is the opposite of that. It's increasing the oxygen to the tissue. So if KATSU is something you're very interested in doing, typically I would do hyperbaric after your weight training, because after the weight training, you take the restriction off, you're looking for blood flow to now resume. And if you resume normal blood flow and hyperoxygenate at the same time, you're going to get a massive flow of oxygen and you're going to get the balance of those two things. The reason to do hyperbaric before something would be for performance. And ultimately, you're not looking for that for this reason. Somebody who might have a competition or a race, or wants to try to improve their workout or their performance, even mental performance at work or different things like this, to do a session beforehand would upregulate that system so that you get better performance going into it. You're looking, I think, for the benefits of recovery. Therefore, I would recommend putting it after. I have a 1.5 chamber with an O2 concentrator. What's the best mask? Cannula, rebreather, et cetera, et cetera. I'm healing from Lyme and have nerve damage. So the answer to this question is not a great answer, maybe. I don't know, but it's the truth. There's just not enough of a difference. In a hard chamber with 100% oxygen, your choice of mask or hood or what they call bib, your breathing system, basically, your built-in breathing system. There's tons of options. And in those cases, the delivery system could matter, and you can get more or less depending on what you choose. When you're using a soft chamber and you're using a concentrator, the flow is not high enough and the pressure is not high enough to do anything other than sort of that typical, some are vinyl or plastic derivative masks, some with a rebreather. I like that better than without. But ultimately they're leaky. In other words, they don't fit perfectly. And when you breathe, they bring in air from around your face as well as the air from the concentrator. It has to be that way because the flow isn't enough for you to only breathe oxygen. If you had it so well fit and you tried to take a breathe and the flow wasn't turned up high enough, you would feel like there's not enough air coming through the mask. So you really just can't do that type of setup with a typical oxygen concentrator. Therefore, and then that compared to a cannula, the cannula is the epitome of a leaky mask. So rough numbers, it's not exact. Imagine your concentrator put out 95% oxygen and you had the best fitting mask you can get and it had enough flow, you could say, I'm breathing 95% oxygen. If it's a typical mask that doesn't fit perfectly, that allows for a lot of air to leak, you're breathing 95% oxygen, but you're getting a mix. That 95 is probably more like 85 to 87. And if you're using a cannula, that 85 or 87 is probably more like 45 to 50 max. So they're all options. They all work. Some people have preferences one way or another, but just understand there are limitations to the different breathing systems, and none of them are perfect, unfortunately. But in our clinic and clinics that we help open or patients that we help get equipment, I typically recommend the more standard mask that you probably have. So here's a question, but this person couldn't join us, but I'll answer it because we're recording it. So I'm interested in hyperbaric regarding my vision and my hearing. I bought a home chamber. We're up to 40 dives. My little boy adjusted 8 months now, cardiac arrest, 35 minutes at the age of 2 months. He was about, I think, without oxygen, 10 minutes is what this is saying. If you could you please ask the best approach regarding vision and hearing? I would be grateful. So, you know, from what I'm understanding, because I have a few questions here, but if I'm understanding it properly, we're dealing with, you know, an anoxic event of roughly 10 minutes, which is very significant. You know, we're also dealing with somebody very young, and somebody very young, the best part about that is their brain is young and growing, and cells are dividing, and you know, the likelihood of, they call it neuroplasticity, is, you know, the process of a brain creating new connections, let's say it like that. So, you know, when we're young, we're constantly making new connections, breaking them, making new connections and breaking them. And so, you know, the likelihood to show some benefit here is high. I like the soft chamber here. I also like the hard chamber here. I like some sort of mix of both. And, you know, in an ideal world, there would probably be some mix of both. And the other real recommendation I would have would be the ketogenic diet. Same reasons I've said before in terms of the likelihood of improving nerve function, brain function. Vision and hearing are specifically certain centers of the brain, and we're trying to improve their function. There's nothing that's vision so specific or hearing so specific that I could really recommend, other than those might be areas of the brain that were more damaged. And, you know, these kinds of therapies, you know, nutritional therapies are systemic. They go everywhere. Oxygen therapy is systemic. It goes everywhere. So the red lights, the nasal red lights, because we're getting close to the cribriform plate, the ketogenic diet and oxygen would definitely be things that I would want you to consider. So those are all the questions that we had submitted. We are 7 minutes over our promised time, but if nobody, if everyone's okay, I'm going to just quickly go through questions in the chat. If you've had your questions answered and you want a boogie, feel free to, you could do that as well. But I'm just going to quickly go through these and see how far we get. So was the first conversation recorded? Yes, there will be a link. 1 second. My chat is bouncing all over the place. Please post publications that support your comments. Yeah, so I'd be happy to, and or, you know, that's a lot of homework. I already have a lot of homework. In my book, there's 175 references in the back of the book, categorized by condition and or benefit. I please take a look at that. Don't buy my book, just look at that if you want, doesn't matter, but I'm happy to share that information. Go to our YouTube channel, HBOT USA, and I have, I think, 80 some odd videos on a variety of topics. And if it's a research video, I always add the research that I'm pulling it from. So I am committed to giving the best information that I can give, and I'm committed to making sure that everything I say is backed in research. I'm starting my own research. I'm in the middle of a PhD myself. I'm going to start doing my own research on hyperbaric and stem cells and regeneration and, you know, brain function, all this kind of stuff. So I promise you that things that come out of my mouth, I may learn over time that as a result of new research coming out that I need to make some corrections to what I'm saying, but you could also believe that everything I'm saying comes very specifically from things that I read in the journals. And I do post those often. So please take a look at that stuff. Does HBOT detox heavy metals? Not directly, we covered that a little bit. Is there something specific to add for pots and pans? There are many things to add for this. You know, in our clinic, we have a functional neurologist. I think that those folks are some of the most well qualified for dealing with these types of issues. There are certain non-traditional, let's say, docs like functional neurologists that deal with pots and pans. And then there are some more traditional medical doctors who deal with this also. In our Pennsylvania office, Dr. Elliott has been, he's amazing, and he has been specializing in autism, pots and pans, and pandas for quite a few years. He's a member, as am I, a member of what's called MedMaps. I don't know if you guys are familiar with this. We call them MAPS doctors for short. It's the Medical Academy for Pediatrics with Special Needs. I'm on the faculty for MedMaps, but there's, you know, conferences every year, and, you know, doctors interested in understanding most of these concepts and dealing with a lot of these complex neurologic pediatric cases. You know, we teach and we learn a great deal through each other's experiences, and we have a whole curriculum on how to deal with these things. So I'm not sure where you're from and who's asking that question, but check out, for people who've been around for a while, Dan, Defeat Autism Now. That was a group of docs that sort of developed a lot of these protocols for autism specifically. Unfortunately, Dan sort of dissolved and MAPS came out of that. And since then, MAPS has grown from that and, you know, covers a lot of these other neurologic conditions. So for people who are interested in that, I believe most likely you can go to, I should know the link, I don't, but if you looked up MedMaps or Medical Academy of Pediatrics for Special Needs, you'll find the website, and I believe there's a way to search providers that way. Thank you for putting that, Christina. Please post the hydrogen tablets. We're going to post that. I'm sure there's more, but I think I need to boogie. So yeah. Anyway, I thank you all very much. Christy, is there anything, Christina, you want to add? Or?
No, I just want to say thank you for your time. I learned a lot, and all your information is very genuine, and you take the time to help all of our viewers answer the questions. So thank you very much for your time. You're
very, very welcome. I thank you guys all for joining us. Christy, if you want to, you know, we'll collect some questions and comments from this, I'm sure, you know, and if we have a sort of, you know, a different topic, or we want to, you know, continue this conversation from where we left off next time, I'm happy to do that. So why don't we plan in a month or two or whatever, we'll get together and we'll do it again.
Yeah, would love to. Thank you.
You're very welcome. All right, everybody. Thanks so much. Take good care.
Thanks, guys.
Thank you.
Yeah.